Professor Marcus. I'd like to take a few minutes of your time to talk about a critical care presentation, and that's perioperative nursing. Perioperative nursing is an essential part of what we do as nurses to assure safety and proficient care. The first thing I want to bring to your attention is inherited malignant hypothermia. It's also called MH. ATI focuses on this in terms of you making sure you do a full history and physical. Many times with MH, patients have a history of problems with general anesthesia, or in the family, problems with waking up from anesthesia and whatnot, aspiration. So if the patient shows any signs of this during surgery, you need to know, even though you're not in the surgical room, that surgery is stopped. Dantrium or dantrolene is administered 100% oxygen, and the patient is cooled down with ice lavage and ice to axilla, groin, neck, head, and also IVs of sodium chloride. So, inherited malignant hypothermia. What else do you need to know? ATI wants you to know about general anesthesia meds, such as Propanol, P-R-O-P-O-F-O-L. It is the most commonly used anesthetic agent. However, if there's a patient history to allergies to egg and soybean, they are not a candidate for this medication. We use other medications in surgery as catalysts to help patients through the surgery, such as opiates, fentanyl, diazepam or Valium, benzodiazepines, and Versed, which is medalazine. These decrease anxiety. Sometimes they create amnesia, which is what's therapeutically done. Antiemetics are given: Zofran, Reglan, Vinergan. Anticholinergics, atropine. Dries up secretions and prevents any possibility of aspiration. Regarding aspiration, your patient has been NPO usually after midnight. However, it's a minimum of 6 to 8 hours that we keep them NPO. You are able to give your medications with a sip of water. However, you should confirm this with the physician. But some of these medications are integral. Also, many times with the blood sugars, you need to clarify if you should be giving oral hypoglycemics or any insulin the night before or the day of surgery. What else does ATI want you to know? There's also, besides anticholinergic, sedatives are used, such as Nebutol and Secondol. Neuromuscular blocks, such as citicoline, which is a skeletal muscle relaxer. And also fast-acting barbiturates, such as pentothal. What are your nursing actions? Besides the history and physical, you have to you assist with the consent. The doctor explains the procedure to the patient. You witness it. That's fine. That's part of your nursing responsibility. If the patient has any questions about the surgery and you are uncomfortable, it's not within your scope of practice, you immediately contact the healthcare provider. Everything is put on stop until the patient is fine with the surgery and understands, or at least is appeased of any anxiety or questions they have. The checklist is signed by you and the patient. You also take the dentures and the hearing aids and put them in safe places. We do not want to lose those. What else is your responsibility? You want to make sure when you obtain the consent, the patient is of legal age. If not, you get the parents involved. If the patient has not had any medication, that changes their central nervous system. What else? We also use local anesthetics, cane drugs many times. Many times you'll start an IV before the patient goes in. Usually 2 IVs are started. That depends on the situation and the type of surgery. What you want to make sure post-operatively is your ABCs. These patients many times have been intubated, and so you want to make sure that they're not having any respiratory complications, difficulty swallowing, laryngeal swelling or soreness, that they have bowel sounds, all 4 quadrants. Listen for 5 minutes if you have to. Many times we have ileuses after general anesthesia. It's a very common complication. A urine output. Palpate the bladder. Make sure they can void. If the output is 30 milliliters or less, it could be a sign of shock. If you suspect shock, you would elevate the legs and lower the head. One thing I want to teach you about is the Aldret score, A-L-D-R-E-T. This is a score that uses respirations, oxygen saturation, consciousness, circulation, activity. Higher the score, the better. And you need to be familiar with this score. If the patient needs to be shaved, you use an electric razor. Coumadin and warfarin, you have to watch if they're taking any holistic medications. Ginkgo biloxi and some others many times affect the absorption of Coumadin, and you need to make sure that you've done a full history to know if they're taking any homeopathic medications that could impede also. Usually Coumadin is stopped before surgery and the patient is put on something such as Lovenox, an antithrombolytic. Basically, that's it. I want to just review, it is your nursing process again, your history and physical, your understanding about the critical aspects of surgery that will make sure the patient is safe and has a good experience in the OR and postoperatively. Thank you for your time.